And I need to offer a special word of thanks to Eldon James for introducing me to our distinguished panelists. I'm really thankful, and I'm really thankful to both of them for participating today. I know Ms. Vesley moved her offices on Friday, so she's making superhuman efforts to be with us, and I'm very thankful to her. So I think she's going to speak first, so I'll start with her introduction. Kathy Vesley is President and CEO of Bay Aging in Urbana. That's the Area Agency on Aging, public transit provider, and senior housing developer for a 10-county region in Eastern Virginia. She led the development of the state and national award-winning VAAA Cares, which I think you'll hear about today, a statewide innovative and successful hospital-to-home transitional care program. Ms. Vesley earned her undergrad degree from the College of William & Mary and holds graduate certificates in public administration from VCU and American Sign Language from Gallaudet. So welcome and thank you so much for being here. Also want to introduce you to Regina Sayers, who is the Executive Director of Appalachian Agency for Senior Citizens, has had that role for 10 years. She leads 214 employees there and directs over 30 programs. Prior to joining the agency, she worked for 34 years in the medical field. She has a bachelor's degree in human resources and medical technology and a master's degree in healthcare administration from Marshall University. And during her tenure with the Appalachian Agency for Senior Citizens, she's grown and cultivated the community-based transition programs and the PACE program, which I think you'll also be hearing about, from 35 participants to a current enrollment of 107 and revenue of $10 million. And she received the 2019 N4A, which is the National Association of Area Agencies on Aging, Excellence in Leadership Award in New Orleans. And so I am just so thankful to our guests for coming to speak with us today. And I will, if you give me just a second, I'll share my screen and I'll tee up the first slideshow. We'll share right here. Can you all see those?
Yes.
Okay, great. So let me go back here. I may not be able to do quite a slideshow, but we'll make do there. Okay, over to you, Kathy. Thank you.
Okay, and we'll be moving through these, so I'll be saying next slide to you, Katie. But first of all, yes, thank you very much for inviting me. I think the world of VAAACO and all the work you do, and so to me, it's quite an honor to be able to address you this afternoon. Next slide. I was asked to do an overview of the AAAs, which I'll do. I'll talk about area agencies on aging, and then I'll talk a little bit about Bay Aging specifically, and finally, VAAA Cares, the statewide network of programs. To start off, as you think of area agencies on aging, there is one federal agency that provides oversight, and that is the Administration for Community Living. Then there are 50 state units on aging, and in Virginia, that is oversight is provided by the Virginia Department for Aging and Rehabilitative Services. And then finally, as you look across this colorful nation, you will see that there are 622 AAAs. Every jurisdiction has an assigned AAA. Some of them are part of units of local government, and many are private nonprofits. Next slide. Here in Virginia, you see that there are 25 agencies on aging. And just to help you get your bearings, I'm at Bay Aging. Look over toward the Bay, and when you look down and you see 1718, we are PSA 1718, and that is one of the 25. You're not seeing all 25 because up in Northern Virginia, it gets kind of tight. So you have individual agencies, and I appreciate your smile, Lee. Yep, it's kind of tight on a lot of things, but at any rate, there are 25. So I am over here on our east coast of Virginia, and when Regina talks to you, she'll be coming to you from the western part of our state. Look at PSA 2 over there in yellow. Next slide. Okay. All AAAs have capacity to do all services. However, all of them aren't functioning the same. For example, when we talk about transit, Regina and I are very rural, so we're doing some public transit, whereas most AAAs are simply working on rides for seniors to senior centers or medical appointments and things of that nature. But of the services that are provided to older Virginians, the bold ones are ones you can find most anywhere, and many of the others too. But outreach and doing counseling to help people find the right services that they need, meals, congregate dining, uh, many types of programs that are aimed to help people make insurance decisions or also aim to prevent fraud, and a few legal aid services that we are able to contract for, and some in-home. So a wide variety there that we won't have time to go in today, but just to give you a heads up to be looking at your local AAA and determining what they have and also working with them on capacity for the future. Next slide. Now, many people are not aware we actually provide services to all ages, not just older citizens. As I already explained in transportation, we have public transit, so we're doing all ages, but also communication, referrals, assistance. We'll do that for anyone because most of our clients aren't older. I would say the actual recipient may be, but most of our calls and most of the information requests are coming from adult children who are looking for what can I do to help mom or dad. We are, and this is extremely important, an aging and disability resource center. Take that away. AAAs are designated in code as aging and disability resource centers. That means you call your AAA, it's not just about getting the aging services, but we are trained and we are responsible to hook you up with any types of services you may need for someone who's older, someone with disability, or other needs, many times financial needs. Next slide, next service, next slide. So today, as promised, we're going to give you two very brief case studies. One will be about Bay Aging, the nonprofit over here, serving the 10 counties, rural counties of Northern Neck and Middle Peninsula. Also mentioning our statewide network collaboration, providing service of VAAA Cares, and then talking, mentioning just briefly, but our national financial management service, we do financial management for a number of veterans directed care programs. That will be followed by Regina regaling you with the services of Appalachian Agency, and you will be impressed how diversified they are. And I can't wait to hear about the PACE program. That is always very interesting. Next slide. So Bay Aging, I've already explained, our primary service area is the 10 counties. And when we're in these counties, we're looking at any number of services. I think they said Regina runs about 30, as do we. We run about 30 services at any given time, and always looking to expand what's next. What are the boomers going to be wanting? What are we going to want as we get older? And so we have to constantly be evolving. Next slide. Our vision is to be able to deliver a choice of services, a wide range of services that people need as they age or have other needs in the community. And our mission is to deliver these services with high quality and efficiency, and of course, being cost effective. Next slide. If all works well, we help people live in their homes or community for as long as possible and do so as independently as possible. And we do this under the auspices of our governance of our board of directors. We have a volunteer board, and each of our counties appoints some representative to our board of directors. And in turn, we have three major service areas that I will mention briefly today. Our staffing at any time will have 300 to 350 because we have quite a number of part-time staff who do driving and also who are in our AIDS program. And we're very proud. Last year in our region alone, we gave direct service to over 23,000 individuals. So for a small rural AAA, we're proud that we're doing a lot. Next slide. Community living programs are best known, and I lead this with bold options counseling, gateway to services, because any AAA worth their salt, if you give them a call, they are going to help you work through what the needs are for you or for a loved one, or oftentimes too, it can be the minister calling for a parishioner or whatever. But we can help work through what the options are that are out there. So as you can see, the list of health and wellness programs is long, and we're very active not only in direct services, but educational programs and doing a lot of advocacy to help people make those right insurance decisions, or to work with them on senior employment or ombudsman if they feel they need some extra support out in the community. And most of the county funds we receive for aging services go into some of these programs. Next slide. Meals on Wheels, I don't need to explain it to you, but that's where most of our local funds go, into our Meals on Wheels program. And here, I will meet with you after class if you don't understand how Meals on Wheels works, because it's a fabulous program. But here, what you're seeing, I just wanted you to see Carol Hamlet, one of our longtime 8-year volunteers, who says that this is some of the most rewarding experience she's ever had in life. So if you're not a volunteer, please feel free to get in touch with your AAA and sign up, and encourage your friends and family. Florence Holmes, who is sitting here, has been receiving meals from us for about 3 years. And I love how Florence, how she summarizes it when she says, Carol visits, it provides sustenance for my body and soul. I couldn't put it better, so I'm glad that she did it so very well. Next slide. Our home care services, here again, we're trying to keep quality of life. Some of these services are geared to people who could or would be in a nursing home or some other institutional facility. Instead, we're trying to put an aide in who can help them with bathing, dressing, all the fundamentals of living. But we also do some programs that are just companionship and socialization. We have some limited financial resources so that it is at no cost to the individual, but we also offer private pay opportunities because there's simply not enough of these services to go around. And unlike many of the programs, meals, many of these programs were for Older Americans Act funded, the federally funded programs, you have to be 60 and over. These programs, a lot of our programs then go to 18 and over, and are some financially based and some not. Next slide. Okay, single family housing is one of those areas of program and service where it is based on income, and families of any age can get assistance from us. We often partner with local governments rebuilding an entire community, but the government, the county will apply for the funding, and then we can go in and rebuild. Lots of partnerships go into doing weatherization and home repair, but I tell you what, Regina has better slides on the housing in some of her communities, so I'm going to leave that to Regina. Next slide. Then in our multifamily, we are very proud. We have developed and we manage 10 senior apartments. I say senior, but I use that very loosely. Uh, you have to be 62 and over. And as we know, that's not exactly senior anymore, but 62 and older and living at 1/2 area medium income. So if you qualify and if you can get in off the waiting list, then never spend more than 1/3 of your income on the housing itself and on your utilities. So we have 366 people living in these apartments and they're getting supportive services, but our waiting list is more than twice that. And frankly, this number is out of date. We are now up to almost 900 individuals on waiting lists. They'll never get in, so many don't even bother to sign up. But a wonderful opportunity if you can get in, but there is very, very, very limited funding to build senior housing, unfortunately. Next slide. But one of the lucky people who was able to get in was Mary and her dog Destiny. Now, we were working with Mary when she was living in her home place, which was, it was in very bad repair. We couldn't find funds anywhere that she could qualify for to do the repair that was needed on that place. We could take her meals and such, and she kept saying, like so many of us, no, I'm going to stay in my home. I'm going to stay in my home. And we couldn't convince her. But one morning, Mary and Destiny woke up with a snake in their bed. And so we couldn't convince her, but the snake did. So she had to obey aging housing as quickly as she could. I think we all understand that. Okay, next slide. Bay Transit, I've talked about a couple of times, and I know Regina also does public transportation. And as I said, all reasons for all ages. And just it's interesting that in this rural area, most of the requests for services are for rides to work, then rides to healthcare, and then finally for other opportunities to do business in the counties. Next slide. Here is Art Doobie. Art Doobie has been riding Bay Transit for 12 years. He was a very young veteran when he started working with us. And frankly, at 78, he's still a very young veteran, but he is legally blind. So Art has told us for years, if it weren't for Bay Transit, some public transit, some senior transit, he could not live in his home and in his community. So he is another great, I think, PR rep for us. Next slide. Next slide. Yeah. Are we stuck? Well,
Sorry, it's just frozen here.
well, that's okay, Katie.
There we go. There we go.
I was going to say I'll go ahead and talk while you unfreeze, but our veterans directed care, I'm not going to talk about it a lot because you must be referred by either McGuire, Hunter Holmes McGuire in Richmond, or the Hampton VAMC in order to qualify for the program. But this is designed for veterans who are nursing home eligible, but they want to remain at home. It's been extremely popular during COVID, as you can imagine. So the veteran gets his own budget. It's called Veterans Directed because the veteran will get his budget. Could be $2,500 a month, could be $3,500 a month, and he determines how he wants to spend it within reason. So he sets the salary for the caregiver. And the caregiver can be anyone he wants. It can be his wife, it can be his son, it's anyone, but this gives the veteran the control to get somebody they know and trust versus a referral from a home agency, a home care agency. So you can imagine, very, very popular. And we are so pleased to be doing this for the entire state. And we do have other partners in various communities that are helping us. Right now, I think we have around 250 veterans. We are also, as I said, the financial management service in 7 states across the nation. And we hope to grow that because that brings some additional revenues into our area. Okay, next slide. Okay. I'm getting to all the good stuff and it wants to freeze. All right, VAAA Cares. I mentioned this is a collaboration of AAAs that we are spanning the entire state with this program. And this, again, is not reimbursed by our local governments. This, like VA, the Veterans Administration funds the Veterans Directed, and this is funded by contracts with MCOs, insurance providers, and health systems. Now, why are we selling our services, so to speak? Well, the funding from the Federal Older Americans Act, state funds, and local governments, everyone works as hard as they can to fund the services for an older population. But the population growth is such that it's near impossible. So as part of our advocacy, we are really working to be entrepreneurial and try to find those who will buy our service. And this is a little bit, I always say, describe it as the Robin Hood syndrome. And that is, they have the funds. If they'll pay us to do services, we can get a small net revenue so that we can apply it into other areas where we would be short of funds for aging services. Next slide. I think the next slide says it better than my words. If you look at this slide, you're seeing the green, the little green line. That's the, it's a little bit dated, but I couldn't get an updated one. But that's the growth of Medicare. If you looked at Medicaid spending, it'd be just about the same. These lines are going up at an alarming rate, taking so many resources. And meantime, our aging population, as you look at that red line, it is really rapidly increasing also. What is not is the Older Americans Act, which was always the backbone of agencies on aging. So if you see that sad little blue line that looked like it had hope a few years back, but then went right back down again and is staying flat, that's the Older Americans Act funding and most other sources of grant funding. Next slide. Now, at the same time that we are realizing that we need to get busy, and for our agency, this was right around 2011, 2012, we got started on this, there began to emerge an acknowledgement that most of the population health, the biggest indicators of health, were in the socioeconomic and health behaviors. That's 70%. We all thought it was just the clinical care. I think even the clinicians thought it was just the clinical care, but where do we live? You go to the hospital, you go to the doctor, but you're at home most of the time. So the way we go into homes already and the way we can bring services together, that is very fortuitous that we can go to these companies and say, hey, you should give us a shot on some of this. Next slide. Now here, our major program is a hospital to home transition of care. And in the hospital to home transition, we are working with the most chronically ill individuals, and we will go to their home and we will review their diagnosis. Do they understand? Do they have their meds? Do they know how to take them? Do they have a PCP appointment? Do they have transportation to get there? We are doing all the fundamentals in med reconciliation. That's one of the greatest causes of a prompt readmission or people just deciding they weren't going to take the meds or couldn't afford them. Our job is to get in there and make sure that all this happens. We can incorporate a whole long list of educational programs depending on the individual's need. It is an a la carte menu, but we can help guide what they need to know. And then the other services that are now recognized, the social determinants of health, as they're popularly called. But I want Regina to talk about this too, because I think she has a real clever way of describing how all of this comes together. Next slide. Oh, outcomes. If you're going to work to sell your services, you need to have your outcomes. So what you're seeing here are 5 different demonstrations by VAAA Cares. In these demonstrations, again, we were going to individuals at high risk of readmission. And our job was to make sure they did not readmit within the first 30 days. In each of these projects, as you look at this, it's a lot of information, but they're all Medicare and Medicaid. As you look at it on each one, that blue bar, the big bar, that's the number of people we worked with. That's the total number of people we enrolled. Then next to it is the red bar. That's the expected readmission, the expected number of people who would readmit, and the percentage. As you can see, CMS set expectations for readmission anywhere from 23 to 25% within 30 days for these very chronically ill individuals. But then that green bar, you look at that green bar, and they're the number that actually readmitted after we had done our intervention and worked to get them the services. And so there you see, instead of 23, 24, 25%, it went anywhere from around 4% to a high of 12.8% readmission. And each person that doesn't readmit saves us all about $10,000 each. And that is after you back out the cost of the program. So that high number under the CMS Medicare demonstration, during that period of time, it was $26 million that CMS saved. This is important to all of us. It's not just important that insurance companies and health systems are getting this assistance. It's important for patient care, that they are healthier and having better outcomes, and for all of us who are trying so hard to triage and to provide services with an overwhelming number of people who need them. So next slide. This also brings us to the revenue trends. Again, we started this in about 2012. If you look at the turquoise, that light blue, the prettiest color on there, I think, in 2012, 24% of our budget came from private sources. Mainly that was Medicaid reimbursements. Now we're over 50% of our budget coming from private resources, from fee for service. And this year it's going to grow to about 60% this coming year. That light blue helps all of us because then we get a small margin that we can reinvest into other aging services that we can't afford. Meantime, look at that green piece of the pie. The green piece of the pie is what our counties are donating, and it looks small, 5% of the budget, but that money allows us to draw down federal and state aging funds. So extremely important, and we're extremely grateful for that. Next slide. So how can you help? If you're sitting there and you're thinking this is just educational, I'm asking for your help in 2 ways. I want you to be sharing this with your citizens, because I'm sure there are times where people are talking about someone in the community, and you need to make sure you know you have this great resource, and advocate for the AAAs with your other local and your state policymakers. Make sure you're helping us get the word out about what great services we provide. And maybe you could even do a little encouragement in Ohio, Indiana, some other areas. Their legislators have said, oh, you will give your Medicaid assessments and care coordination to the AAAs to help with their revenue. Here in Virginia and in most states, that is not a requirement. And so it hasn't happened. But hope springs eternal. And now that I've talked to VACO, I am sure you will get that fixed for us. All right, next slide. And that concludes my remarks for the moment. But the next case study will be Regina and Appalachian. And I tell you what, you're going to enjoy it. So thank you very much. I'll stick around in case there are questions.
Well, thank you, Kathy. And you are always a hard act to follow. I probably should have went first, but thank you very much. And good afternoon, everyone. It truly is an honor to be here and to present to VACO. And as Kathy says, we need you. And I'm going to show you why we need you, because we feel that the AAAs are the intersection. We are able to connect housing, transportation, healthcare, and aging services. But I also do want to remind you, a disclaimer, that all AAAs, while they can make the connection needed to allow our aging population to live independently and productively in our communities, but we're all very different in our makeup and our delivery. Next slide, please. The intersection, connecting housing, transportation, healthcare, and support. Appalachian Agency is one of the 25 designated AAAs. And like Kathy, a few years ago, we looked at we did a strategic retreat with our board members and decided we were doing so much more than aging services. And we had moved into that realm many, many years ago, even before I came on board. So we needed to we needed to do strategic planning, and because AAAs are evolving all the time, as you can tell from over the last 30 years. So we reviewed our mission and we changed our statement to actually reflect our current services, and that's to advocate, plan, develop, implement, and promote independence with a high quality of life for healthy aging that benefits individuals and families of all ages in a sustainable, livable community. Next slide, please. Okay. Our objectives. So today, I hope that you all will see why is connection to housing, transportation, healthcare, and aging services so important. Who's responsible for that connection, and how referrals, and who can make those referrals, and how the connection's made, and what are the partners in some of these ventures, and how does connecting all these services support missions of AAAs or even your community, and what are the long-term benefits? Next slide, please. First, I want to talk about healthcare, and as Kathy said, the PACE program. Appalachian Agency and Mountain Empire are the only AAAs in the state of Virginia that actually manage and operate a PACE program. The PACE program is a program for all-inclusive care for the elderly. We were granted the rural designation in May of 2008, and we accepted our first 8 participants at that time. The PACE program is for anyone that's 55 and older, that they meet the eligibility to be placed in a nursing home, but they still remain in their community, and they want to remain in their community and age well in their community. So some of the things that we do provide, I always tell everybody we are like Humana on steroids. We have a license to practice medicine, and Humana does not, even though they do tell us what medications, everything we have to take. But we have a medical director, we have a nurse practitioner, we have all the nursing staff, RNs, LPNs, we have pharmacy, clinical pharmacy, we have all the restorative therapies, registered dietitian, a social worker, we have an adult day center, we have transportation, we have in-home care, personal care and homemaker. We, as Kathy, you heard Kathy talking about the social determinants of health, we truly, through the PACE program, manage those social determinants of health. We are all inclusive. A lot of nurses come to our program and they go, "Oh, I thought we could do this in the hospital." But then they realize that the care is outside those walls of the hospital. And one of the reasons, or many of the reasons, as you can see there, that Appalachian Agency went into the healthcare program was because of lack of access to not only primary care, but specialty care, lack of behavioral health and mental health services, the distance to travel for those specialty appointments. And it truly did support our mission. And some of the other programs that we have added, not only to PACE, but to our agency as well. You heard Kathy talk about the care transitions intervention. We have contracts with managed care organizations. We have contracts with the local hospital system, and we have that care transition intervention program called Bridge and Link, where we work with those high-risk individuals that are at a risk of being readmitted into the hospital within those 30 days. We participate and sponsor community health fairs. We have our own employee health program, and we are very big advocates for telehealth. We have that in PACE. We have telepsychiatry, have a contract with UVA. But we are also in the process of setting telehealth up in each one of our nutrition sites. And of course, COVID kind of put a hiatus on a lot of that because we are obviously waiting on the equipment where a lot of the production plants did close down in March, and now they're trying to catch up. We also have worked with pharmacies within our community to help our individuals with medication management, and that's a big program with care transitions intervention. And a quick story is we had an individual that she was being admitted to the hospital every 3 to 4 weeks, and the hospital could not figure out what was wrong with her. Well, when we went into the home in the Bridge program, we realized we asked all of those social determinant questions, and we realized that this woman did not have a Part D. So she was not getting her medication. She couldn't afford them. So the hospital would give her 2 weeks worth, and then after a week after she wasn't taking her medication, she would be readmitted. So we were able to get her on a Part D, and this has been probably 4 or 5 years ago. She has not been admitted, but maybe one time in those 4 or 5 years. So you can see what a difference that made in that person's life. We also have the wraparound services within our agency, such as in-home nutrition and those other aging services. Next slide, please. Aging services, you did see those with Kathy as well. Nutrition, care coordination, in-home care, home repair, the aging services, elder needs, senior Medicare patrol, ombudsman. We have all of those as well. And under nutrition, there are multiple programs. And one of the newest ones that we're very happy about is our pet food program, which was recognized this year as well. But care coordination, again, that information and assistance and everything that Kathy was talking about. And it really is in care coordination, connecting those community resources. And in home repair, we have something that's very different, emergency repairs and home modification. We saw a need several years ago because we couldn't even build a ramp without a licensed contractor because they put a lot of standards and regulations on our programs. So we actually hired a Class C licensed contractor who does a lot of work, not only for the agency, but for PACE and for our home repair clients as well. Next slide, please. This is how we are able to connect our community resources. This individual was not able to actually access their home. They didn't have a usable road, nor were they able to get in and out of their home. So one of our care coordinators actually partnered with the USDA Rural Development. And as you can see, what a beautiful road they were able to then build. And also they built a porch and access so that this individual could get in and out of their home. Wonderful partnership. And this lady is so happy and enjoyed her porch all summer. Next slide, please. Another project that we worked with the Housing and Development Authority as well. This individual had not been able to bathe, to shower, because they couldn't get into the tub. And they normally don't like for us to take out tubs, but we were able to actually put in a shower And as you can see, what a difference it made for this individual. And they can remain in their home, which is exactly where they want to be. We were also able to replace, with the help of housing, to replace an individual's heating and cooling system. Next slide. Another project for this individual to a home modification for a ramp so this individual would have access in and out of their home. Another project as well with rural development and with Center for Independent Living. Next frame, please. This is an individual that was a PACE participant when they came into our program within the last year. They actually did not have a lot of help in their home. Their children do live away from here. They had no trash pickup service, so they really didn't know what to do. Our staff, our in-home personal care and homemaker staff went in, and you can see from those before and after pictures, this individual is able now to live in a clean home. They feel cleaner, they feel healthier. Their services that they are getting are giving them the ability to stay in their home. They are now able to be organized and to live that productive life where they want to be. The next frame, please. Again, this was another opportunity for us to find accessibility to and from this home as well. There was not a road in and out, and this individual would have to, especially during the winter and the rainy season, would have to walk, and there had many falls and was admitted to the hospital because of that. And we actually just fixed the road, and now they are able to get in and out of their home. Next slide, please. Housing. Kathy talked about their housing project, but housing can come in many forms. And we actually own about 9.38 acres of land that is adjacent to our property. So it was a mobile home park. We did not own the mobile homes 10 years ago when I came on board, but we now are owners of 11 of those mobile homes. One of those was donated, and we actually made a duplex because it had a bed and a bath on each end. And so we made those completely handicapped accessible with universal design. And so we were able to move. As a matter of fact, we do no advertising. We have no openings. As soon as we do have an opening, they are automatically filled. Our openings are. So we have developed our senior living community. We actually, Brian and I, when we came on board about 10 years ago, we thought that the mobile home park was the albatross around our neck, but we realized we are owners of this. So now what are we going to do, and how are we going to maintain and develop this? So we decided to develop it into a senior living community. And as people left, then we through attrition, we either purchased their mobile homes, or when they left, we were not allowing any younger people to come back on to move into the mobile home park. We did go to a meeting on housing projects to see what we could do and to improve what we're doing. And during the roundtable, when we told them, Brian and I said very quietly, we own a mobile home park. And everybody went, what? We said, we own a mobile home park. And they went, oh, how cool was that? So Brian and I left that meeting there in Blacksburg at Virginia Tech, and we were like, wow, maybe we have a diamond in the rough here. So let's change the way we look about it. Let's change our perception. Let's change the name of it. And so from that, several years ago, then we developed our senior living community. We also help individuals in the community with other community housing projects. We assist locating available housing for our individuals as well. And we have been looking at and working with real estate developers. And one of the things we're looking at is we originally had a tiny house rendering that we would have loved to have started building those, but the cost of that would be around $50,000 to $60,000. And some of the building codes really need to be updated to include these new designs and for these tiny cottages, and change that building code to meet the demands and the needs for these new designs. So those are some of the things that VACO and as you work with your building inspectors and everything can help to do that as well. We are getting ready to build our second duplex, to build out our second duplex by putting a firewall in the middle, and we will have a bed and bath as well as a common area. And we've set up like a kitchenette, so it's almost like something that you would have in an RV. But most of our individuals, their homes, they have not been able to maintain them. They literally are falling down around them, so they don't have the money for the repairs, and they've lived in them for many years. And as Kathy, I think, alluded to, it's very difficult for them to move forward. Next slide, please. If you were looking down on this is our mobile home park. The one on the bottom right was our first one, which was a mobile home, and we did have a disabled individual that lived in that home. So that home, that was a double wide. That mobile home was already set up for independent living for someone with a disability. If you look to the far left to the bottom, kind of the next to the last is our child daycare. And then the green building there starts our the agency, our main facility. And in front of that, of course, is our public transportation. We hope to eventually, and then we also own the property between us and that industrial park that you see at the top of that picture. And there's about 4 or 5 acres there. We hope to eventually expand into that community, but right now it's actually been used for community garden in the summer. Next slide, please. These are some of the mobile homes that we have actually changed and made sure that that they were accessible. We widened doors, we removed doors, we widened hallways, we widened doors into the bathrooms and made all of these accessible and added ramps as well. And as you can see, they all have very nice patios on them as well. Next slide. Transportation, as we all know, when we do our needs assessments, transportation is almost always in the top 2 or 3. People cannot, there's not enough transportation. People don't have transportation to and from their doctors or to the pharmacy or to the grocery store. Appalachian Agency does have public transportation. We also have PACE medical transportation. We have contracted transportation. We work with one of the managed care organizations. And we now, our latest is veterans transportation. And before I finish this slide, actually, we received a grant from the National Aging and Disability Transportation Center for a pilot project to work on transportation for individuals that need transportation to dialysis and chemo treatments. So that will be our next transportation project. Next slide, please. Our public division, it's a fully coordinated public transit system. We do have deviated and fixed. We have a deviated fixed route. I call it a fixed and deviated. And there are multiple routes in each one of our counties with assigned stops and times. We also connect with transfer points, allowing travel between counties, because we serve 4 counties: McKinnon, Dixon, Russell, and Tazewell. And those routes do include major housing communities, development communities, and senior housing. And the design of those routes is so that it really includes their life needs, such as retail, grocery stores, medical facilities, our government offices, library, and colleges. And you would think that this is only for seniors, but our average, the average age of our rider is 20 to 40 years of age. Next slide, please. But there's plenty of opportunity for our older population. And we, as we all know, we need to make sure that they have the freedom and independence to improve their quality of life. We route our schedules to include hourly stops at all agency senior community centers. Most of our agency participants ride the bus to the centers. It does provide social interaction. Many of our seniors go out on the same days to shop. They view this as a group event. Although during COVID, it's been a little difficult and ridership has been down, but they continue to meet and share. Does prevent loneliness. So our staff, our training focus is on being friendly and understanding while also providing assistance. Next slide, please. And we're always working to improve our service. We are always continuing to review our routes to stay current with changes such as housing, employment opportunities, and shopping centers. We usually have a seat at the table with economic development within our counties to help them to potentially set up Work Express for communities if there's an industry that's coming to town that they feel like that there are individuals that may need travel to and from. They may need transportation to work and home. So we do try to listen to our community to address their growing transportation needs. Again, we work with our local governments to expand our services with new routes for their community. We are currently expanding into non-emergency medical transportation, as I mentioned earlier, with individuals such as VAO or companies such as VAO. And then we also are providing transportation for our veterans to the 2 area veterans hospital. One is in Tennessee, Mountain Home, and the other one is Salem, Virginia. So both of those are at least a 2 to 2.5 hour ride on a good day for an individual, and some may be even longer. So we are working towards having those transportation for those individuals for their appointments. And then we also are in the process with this new grant. We will be contracting our PACE transportation for non-PACE medical transportation with this new grant. Next slide, please. This is our new veterans transportation van. We actually have a driver who is a veteran. We felt like it was very important that we had a veteran to drive because they would be able to have that camaraderie and be able to understand each other and understand the needs. And this is a beautiful van. We were going to have an unveiling in April and it did not happen, but it's still on the road anyway. Next slide, please. We could not do any of the programs that we have without our partnerships. And to me, it's always on the top of our list is our state and local government. They are such a big part of the decisions that we make. I give them a call all the time, our administrators, and they probably are tired of hearing from me, but that's all right. I call them to see what we can do for them and what they can do for us. We have the local housing authority, HUD, Department of Housing, Habitat for Humanity, Rural Development, USDA. All of these partners are very, very important. Our faith-based organizations, cannot say enough about them. And then, of course, our local businesses. And we're even working with our recreation parks right now to develop a disabled park for our children and our adults. And we have almost 2 projects going at one time. So we're real excited about that. Next slide, please. Of course, Department of Social Services, Independent Living, our community service boards, community action boards, hospitals, our healthcare systems, dental communities, managed care organizations, our local food pantries and grocery chains, charitable organizations, our farmers market, our local colleges and universities, and we are experiential. We have a lot of experiential contracts with their local colleges and universities, and we also work with many of their programs in our K through 12 education as well. And of course, foundations and grant opportunities are very important to us to be able to have seed money to start and develop new programs as well. Next slide, please. So how to connect at the intersection. We always tell our AAAs to define their mission and vision, and if they have to redefine that. Of course, we use surveys, know what available agency services you have, identify any of those opportunities, do strategic planning, develop those partnerships, and always invite yourself to the table, join those community boards. And the one thing we say, yes, if an employee or someone comes to us with a project, we will say yes, and then we'll figure out a way to do it. And then we use those resources to make those connections and to develop and implement those plans. Next slide. So you can see how our AAAs truly are the intersection for housing, healthcare, and transportation and aging services. They have the ability to make those connections. And Kathy mentioned the aging and disability resource connections. And those are the ways that we are able to refer those individuals. If we can't provide it, we know someone that can. And I am going to tell you one quick story, the next slide, and this is how the connection truly works. Starting with healthcare. Both these individuals came into our PACE program with multiple comorbidities. They were very sick, Miss Linda, and we are able to share their story. Linda joined us 6 years ago. Billy joined us 4 years ago. Billy moved into our housing. His home was no longer able. He was no longer able to live in his home. So he came to us about 2 years ago, and the staff said, well, we're not real sure how long he'll be here, maybe 6 months, because he's really has a lot of pain in his legs, and we're just not real sure how long Mr. Billy's going to last with us. Well, we encouraged him to come to the adult daycare. Linda already attended the adult daycare. So as you can imagine, the two of them became friends very quickly. Linda also moved into our housing because she wanted independence and wanted to move out of her children's home, her daughter's home. So we had the health care. We now both had them in senior living. They also had access to transportation for shopping, doctor's appointments, community access for everything they needed. We also provided them with aging services, home delivered meals, farm fresh, evidence-based programs. And while in adult day center, they fell in love. And it truly was a community effort to pull this wedding off. We were planning it for April, but COVID happened. And in August, these two decided they wanted to get married anyway. So in 2 weeks, using physical distancing, we do not call it social distancing here, but physical distancing. It was a community effort. Our mayor, who was also a pastor, did the officiating. Decorations and flowers and photography was all provided by local businesses. The agency did the decorating and provided the reception and the cake. The hotel even provided a honeymoon suite for low cost. So it truly was a community effort, and this is how the community was able to connect these individuals. And Kathy talked about health outcomes and measures. And of course, we always want to show that, but I think this picture shows more than that. It shows their quality of life and how much better it has improved. And by the way, Billy does not complain with his legs hurting anymore. There are no complaints. So the quality of life to me is immeasurable. And the cost, while PACE does save about $7,500 per participant per month, the cost of this is truly priceless. So thank you all. Next slide. If you have any questions, please be sure to reach out to me and or Brian Beck, our CFO. Again, it is about making those connections. It is about of your AAAs. We do need for you to be our advocates and refer those individuals to us. We're here for them. Thank you all very much for this opportunity.
All right. Anybody have any questions for Kathy or Regina? Okay, if you don't, I do. Your rehab programs. You say you work with Humanity or with Habitat. Do you work with any volunteer groups that actually do the work and you provide the resources? Either one.
Yes, I know we do, and I'm sure Kathy does too. We have individuals that do provide some of the physical labor.
Okay, all right. So then you still need, when you do these things, to meet code, correctly? Is that correct?
They have to be signed off by a licensed contractor.
Okay, all right. Second, the Senior Medicare Patrol, what is that?
Do you want to, Regina? You go ahead.
Go ahead, Kathy, you're fine.
Okay, well, Senior Medicare Patrol is a program where we are just trying to alert people, especially seniors, of the various, I guess, different types of fraud that are out there and schemes that go on. So we're constantly doing programs educating folks about what to watch for and how to prevent being a victim of either bad investment or just a real scam.
Okay, all right. Now, both of you have a housing. One, you have the trailer and the other has the bay housing apartments. How do you handle the day-to-day management of those? Do you have an on-site manager or anything who sees to plumbing and electrical problems?
Well, I'll go and then I'll have Regina go. But yes, we have to have on-site managers. We have also on-site, not every day, but we coordinate and move around service coordinators to give extra help to bringing the services on. And then we do have maintenance. We have maintenance that oversees all the basics or brings in a contractor if needed and oversees the lawn maintenance too.
Okay.
And for the agency, we actually have our chief financial officer. Brian would love it if we had a property manager, but he is the complaint department. But we actually do provide trash service for those individuals. We mow their yards during the summer. We hire staff during the summer. And we do have their licensed contractor who we call him our property manager, but he does any repairs or anything that comes in that is needed. Then we also provide that to, we do the repairs for for the ones that are owned by our agency. We repair those.
Now, Kathy had a couple of things she mentioned that maybe we as a steering committee can do. Regina, did you have anything that you thought we could do in terms of trying to influence the state?
Kathy and I talked about that, and I felt like that her slide actually said that as well, is to advocate and to discuss those issues that we need at the state level. Some of those are even as far as the ombudsman, but some of our programs require General Assembly approval for increased funding. But we have had a flat funding, I know, of the 10 years we've been here, and Kathy said 30. So, all of if you would look at our slide, and I should have put that up there as well, you would see that our growth has been in our private and our Medicare and Medicaid. We have had no growth in our aging services, but because of the growth in those other programs, we have been able to, serve more people than what we normally would.
Is there anything of the committee members feel that we might be adding to our legislative platform?
Eldon, would you like to? You're on here if you don't mind. Eldon James is our management for our V4A, Virginia Association for Area Agencies on Aging. Thank you, Eldon, for being here. But that would be a great question as they manage the legislative platform. Or Kathy, you either one could answer that.
Well, Lee, anytime the Virginia Association of Counties can support the efforts of the AAAs, it's appreciated. The federal funds are critical. The federal funds drive the state match. And so anytime we see the federal funds increase, there's always pressure for the state funds. As our two presenters have told you, our federal funds have been flat, and we're hoping that will turn around as things will go forward. The national organization is advocating pretty hard for that. There was some significant effort in the pandemic funding from the federal government that really helped with some stopgap issues, because the demands, especially for home delivered meals and check-ins for folks who are shut in, and dealing with the issues of social isolation. And I think let me just focus on social isolation for just a minute. That is emerging as one of our most serious behavioral health problems for our vulnerable seniors. And in the work that Kathy and Regina have been doing and their counterparts, and we with the state organization, we've been trying to raise awareness on that issue. And I think as we move forward, coming through the pandemic, you're going to see there's some real focus right now to try to determine strategies, because the challenge with the pandemic on that issue is pretty severe, because it's very hard to make those check-in visits when we're supposed to physically distance, as Regina says. And so look for more to come on that as we go forward. We're the state organization is engaged with the gerontology programs at VCU and at Virginia Tech. And we're doing a lot of talking and strategizing on how to address this. There's some interesting things being done in some other states with social media and with that technology to try to do some things that we've never done before in order to address those issues. So more to come.
Lake of the Woods has this group called Low Link, which is a private funded organization where people join and get supportive services and volunteers. But I know it's got a formal name. Do you have any, Regina or Kathy, do you have any connections with any of those kinds of organizations?
Well, we've helped to found several what we call village communities, if that's what you're describing. And that is different people who are participating in a community. They help each other. And rather than it being fee driven, it's I might swap. If you can mow my grass, I can cook your dinner or whatever, but swapping out. So someone who can do transportation does that, while others are doing any variety of chores and favors for each other. It's what communities used to be, but now they have a formal structure because communities have gotten away from that. And this is really just a push back to helping your neighbors. It's an excellent frame. It's an excellent framework. It's really hard. I've had a couple of our local governments who ask what they could do and how to get involved, but it's really hard. I don't know that you can mandate it. It generally seems to be more of just organic, that we're all here, we're aging. And in our counties, I mean, anywhere from 35 to 40% of our population right now is over the age of 65, and it's growing. And we that are in that age group, will be the largest cohort grouping of people for the next 30 years in this region. So I think village communities are extremely important, be it formal or informal, and there are great designs. And I also would like to answer your other questions about advocacy and what could be done by VACO with advocacy. And I cannot speak for the AAAs. I'm not sure I can even speak for my AAA. I can tell you what I personally believe, and that is our great success, our growth, our being able to keep a variety of services. And trust me, we're still underfunded. We still have waiting lists for housing or non-accommodations in transit. But all that we can do, and we are doing, it's because we have an opportunity at private contracts. Again, that is something some states have taken very seriously and gave that opportunity. In Virginia, if you got the opportunity tomorrow, it would take some of our AAAs a little time to build out the capacity, but it is very doable. And whereas in other states, there's a mandate, here in Virginia, I will say our Medicaid agency gave a nod, saying we really would like you to do business with community-based organizations, but for the most part, that did not translate into meaningful substantive contracts, more
Okay.
piecemeal.
Thank you.
And I will echo Kathy and agree. That is also, yes, Kathy, you did speak for the AAA, so thank you.
Oh, okay.
All right, Kathy, Regina, thank you very much for your time and
Thank
effort
you.
today. We really appreciate that information, and maybe we'll see at some point, maybe not at this meeting, where we might be able to input some of that stuff to our legislative agenda. All right.
Thank you.
All right. Thank you. Good seeing all of you. Hi, Sharon. Bye, Sharon. Bye, everybody.
Bye.
Okay.
Bye, Katie.
Bye-bye.
Bye, everyone. Bye, Ellen. Thank you, Ms. Frame. Thank you.